Hello everyone. I am sure you must have heard the term cerebral DSA, digital subtraction angiogram. There are many angiograms. You have a coronary angiogram that we do on the heart. Actually, we are not doing, the cardiologists are doing. Then there are you have peripheral angiogram, for the vessel abnormalities involved in the limbs, especially lower limbs. Then we can do angiogram for the kidneys, renal angiogram, for the intestinal arteries called the gastrointestinal. There are so many arteries, some problems, some vascular disorders confined to those areas, liver, pancreas, this intestine and all. But the most important and maybe the most difficult or should be extremely careful are the ones where we do this sort of angiogram called cerebral angiogram. Because you know that the brain is the most vital structure and we have eloquence in every part of the brain. You have many parts because you are your brain or your brain is you. It is as important as that, because if there is a single mistake, suppose the artery to the head, the hand is affected, you get a weakness. If the eye is affected, you get a visual loss. The speech on the left side is affected, you get a loss of speech. So similarly, so the angiogram is actually safe one, but it should be done only by trained hands, and they should know what all things which can happen. Or but fortunately, I have done thousands of cerebral angiogram, and the problem or the consequences are extremely numbered in finger counts. That's all. Usually, the complication occur especially in people with the diabetes or with renal failure or with cardiac failure and all. Or maybe if the patient has got a massive bleed in the brain or has a massive stroke and all. So, what are the various indications to do cerebral angiogram? The foremost indication right now is for stroke, acute stroke. You know that there is a large time window. We can use this this particular method for 0 hour to 24 hours. Rarely we can go beyond 24 hours as well, but usually depending on the level of the salvageable part of the brain, because once there is a blood flow occlusion or restriction of blood flow to the brain, what happens is that the brain would die, that particular part of the brain would die, because there are so many arteries, the carotid artery, vertebral artery, basilar artery, and the branches of the carotid arteries. So, every part of the brain is perfused by these small big arteries, which would be again divided into multitudes of branches, and finally, once there is a blockage in the artery, one part of the brain may get damaged, called the core or the umbra. Surrounding that area is called the penumbra, or this is a viable brain, but may be damaged at some point of time. That depends on the collateral or the bypass arteries. Suppose those bypassing arteries are very limited, that particular person can have a massive stroke within hours. On the other hand, if there are multiple collaterals or the bypassing arteries present in that particular person, he can survive for hours, maybe 6 hours, 12 hours, 24 hours or even longer. Those patients we would find by doing something called a penumbra imaging. There is a CT perfusion scan or a MR perfusion scan, then we know that this part of the brain can be saved or salvaged. Those cases we can go ahead and do a thrombectomy, we can remove those clots, blood clots, and patient would eventually improve to almost normalcy. So, we have done hundreds of cases of thrombectomy. Thrombectomy means there are a clot in the brain, you remove the clot, he is up and about. He can do his activities normally. But on the other hand, if the patient comes after 24 hours, once the infarct or the damage already happened, then it's not possible to reverse those damage. So we have to come within that particular stipulated time, within 24 hours. Early the better. 0 hour or the first hour is the better. So don't wait to have the thrombectomy or the endovascular procedure for acute stroke. Don't wait and waste your precious brain, because you know that time is brain and every second or every minute counts. Okay. Then what are the other things that can be used? we can use for various sort of stenting. Suppose the artery is blocked or getting stenosed, we can open up the vessel by putting a stent. That is the stent you call the carotid stenting, we have the vertebral artery stenting, basilar artery stenting. We can even stent, we can, if there is a stenosis, which is a narrow artery in the brain which causes some weakness or some hemiplegia, some other problem, vertigo, continuous vertiginous sensation and all. If that particular artery is severely narrowed or almost getting occluded, we can open up the artery by a method called intracranial stenting or even extracranial stenting. Okay. After 1995, Italian neurosurgeon discovered this aneurysm coiling. His name was Guglielmi. Actually, the names of the coil is called a GDC coil. Okay. So, the Guglielmi coil is such that it is all made of platinum, it is a costly one. Suppose there is a, the artery is bulge at one point, it is called aneurysm. There is aneurysm sac is there, a neck is there, the artery is like this. So, what happens is this does not have the 3 layers of a normal artery. So, this tends to rupture or can get then the blood goes into the brain causing loss of consciousness, death or all sort of complications. So, and once it is ruptured or if it is unruptured also, we can remove this particular bleb by putting some platinum coils into that aneurysm sac. It is called endovascular coiling. It can be efficiently done, it has been doing thousands or maybe millions of cases been done around the world. So, that is also quite a fascinating outspurt of this particular the angiogram, the uses or the why we are using cerebral angiogram. Once I have mentioned, the most important thing is stroke workup for thrombectomy, then the various stenting works for the revascularization. Thirdly, we can use for coiling the aneurysm, endovascular coiling. Fourthly, we can use there may be various fistulas called AV malformation, dural AVF and all, where there is a abnormal communication between the arteries and veins causing some increased pressure in the brain, bleeding into brain, rise pressure and various headache and other behavioral gait abnormality, weakness and all. In those cases, what we can do is we can put some material called PVA particles or some other glue. We can put histacryl and other glues. We can remove the blood flow to that particular area, and we can save the arteries. We can prevent further progression of the AV malformation. So, we can use glue, we can use various other glue like agents as well. We can also reduce the size of the tumor by putting the PVA particle, and we can debulk the tumor without actual operation. That is one advantage of doing angiogram. And for devascularization or embolization of the tumor, embolization of there may be other tumors in and around the neck, the throat and the skull base and all, where also we can reduce the blood flow, thereby reducing the size of the tumor, sometimes to the extent that we may not need a surgery, because there are some papers on that, just like meningioma getting devascularized, and sometimes if the patient is not willing for further operation, or they can even shrink to a certain extent over a period of years. So, we can also use this angiogram for therapeutic vasospasm, because sometimes after several angiograms, after cerebral hemorrhage, subarachnoid hemorrhage, the vessels goes into spasm. They just shrinks in size. We can put various drugs like papaverine, verapamil or nimodipine into the arteries, and we can increase the size of the arteries, thereby preventing any delayed ischemic events in the patient. So, in short, cerebral angiogram is a newer powerful modality which has been used extensively in India and throughout the world, and it's actually a boon to the people because it's a new addition. Because before 1990 we never had all this thing, this therapeutic armamentarium in our hand. Now it's quite common and people are using it and people are getting the benefit. So I only want to share this new advance with you. I think I am pretty sure that you all know all this cerebral angiogram, the various therapeutic implications related to this. So just to underscore the importance of cerebral angiogram. Okay. Let me conclude here. If you have any queries or questions, you are always welcome. Thank you very much.